Good morning, everyone. So today we are going to discuss the kangaroo mother care. Okay. So first we will discuss the introduction of kangaroo mother care. The kangaroo mother care, it is one of the special care of low birth weight baby. It's improve the health of the baby. So the next we will discuss the definition of kangaroo mother care. So kangaroo mother care it refers to the practice of providing continuous skin-to-skin contact between mother and baby, exclusive breastfeeding and prolonged skin-to-skin contact. Okay, so kangaroo mother care is nothing but it is the main aim of kangaroo mother care is what? To improve the birth weight of the baby by giving the skin-to-skin contact with mother and baby. Okay, so next we will move towards the components of KMC. So there are total 3 components of kangaroo mother care. The first one, kangaroo position, second one, kangaroo nutrition, and third, the kangaroo early discharge and follow-up. The kangaroo position nothing but the skin-to-skin contact between the mother and baby. The kangaroo nutrition nothing but the exclusive breastfeeding to the baby. And the kangaroo so due to the kangaroo mother care, it ultimately leads to the kangaroo early discharge and follow-up of the baby. Okay, so next we will move towards the important parts of the kangaroo mother care, that is the benefits of KMC. The first one, the benefit to the baby, second, the benefit to the mother, third, the benefit to the family, and fourth one, the benefit to the nation. Okay, so there are the total 4 benefits of KMC. Okay, so first we will discuss the benefits of kangaroo mother care to the baby. Okay, so in that, the first one, it offers the skin-to-skin contact between mother and baby. The second, it promotes bonding between mother and baby. Ultimately, when there is a close contact of mother and baby, so ultimately it will helps to provide or promote the bonding, that may be the emotional bonding of the mother and baby. The third one, it's maintain the physiological parameters of baby. The physiological parameters are nothing but the heartbeat, temperature, the pulse rate, the respiration rate of baby. So KMC ultimately helps to maintain this all physiological parameters of baby. The next, the fourth one, it's reduce the risk of apnea, oxygen requirement, and infection in baby. Okay, so apnea nothing but the stoppage of breathing. Okay, so what is the main benefit of the baby KMC to the baby is it's reduce the risk of stoppage of breathing. It's regulate the oxygen requirements of the baby. Okay, so next, it's promote the early discharge from the hospital. Okay, so ultimately if there is a close contact between the mother and baby, so ultimately it will helps to increase the birth weight of the baby. So ultimately it will helps to discharge of the baby from the hospital as early as possible. Okay, so next we'll move toward the benefits of KMC for mother. Okay, so as you know, it's also helpful for the mother also. Okay, so in that, the first one, it's promote the bonding between mother and baby. As usual, it will helps to promote the emotional bonding between mother and baby. Okay, the next one, the mother is less stressed during KMC as another mother is more involved in the care. Okay, so as you know, it is what is the main aim of the KMC? It's the close contact between the mother and baby. Okay, so ultimately the mother will spend the more time with the baby. So ultimately it will helps to reduce the stress of the baby, stress of the mother. Okay, next we will discuss the benefits of KMC to the family. Okay, so there are the several benefits of KMC to the families also are there. The first one, KMC reduce economical burden from family. Okay, so as you know, if the baby we keeping the baby in ICU or the NICU, so ultimately it will increase the economical burden on family. But if we are giving the KMC to the baby, so ultimately there will be a less pressure on family as compared to those are we keeping in the NICU. Okay, so next one, it's promote the early discharge of the baby. So as you know, if the KMC we can give the KMC in home also, so it will helps to early discharge from the hospital. The next one, it's promotes bonding between the baby and the family member. As you know, if the baby is always if we are giving the KMC, so baby will promote it will helps to promote the bonding between the mother as well as all the family members and baby, because the baby is always with their family members. Okay. The next one, the benefits for the nation. Okay, so as you know, the kangaroo mother care, if you are giving the kangaroo mother cares, it will helpful for our nation, our country also. Because the first one, the KMC decrease the neonate and infant mortality and morbidity rate. Okay, so as you know, the mortality means the death rate and the morbidity means the disease rate. Okay, so as we are giving the KMC, so ultimately it will help to increase the birth weight of the baby. So ultimately there will be less chance or there will be reduce the mortality, means the death rate and the disease rate of the neonate and infant. Okay. The next one, the KMC is simple and easily applicable and cost effective. Okay. So for the KMC, there is no any there is no need to give them any training. KMC can be give by the, it can be okay, we can give the KMC at home also. It is very simple process, and the main part is that it is a cost effective. We are not here spending any money on the KMC procedure. Okay. Next, the KMC results in healthier and more intelligent baby. As you know, the KMC, we are always keeping the baby and mother with close contact. It will be also helps in the increase the bonding, and it will also helps in the giving the exclusive breastfeeding to the baby. So ultimately it will helps to become the healthier and intelligent baby. So ultimately it will help for our nation, our growth of our nation. Okay. The next we will discuss the main part, that is the procedure of KMC. Next, what is the KMC? When the babies, okay, so in the procedure, what is the first step of the procedure? So in the first stage, we have to ready the baby and mother for the KMC procedure. Okay, so in that first, we have to ready the family member and the mother for the procedure. So family member, we have to counsel the family member regarding the KMC procedure. We have to take their concerns and we have to create the positive attitudes of KMC towards their family members. The next, the mother should provide with front open gown and baby dress with the cap, sock, front open sleeveless shirt and nappy. Okay, so for the procedure of KMC, we have to provide the front open gown to the mother. Okay, for the baby, we have to dress with cap, socks, front open sleeveless shirt and nappy. Okay, this is how we have to ready the mother and baby for the KMC procedure. The next, okay, in the picture you can see that the mother is wearing the front open gown and baby is having the socks, caps and front open sleeveless shirt. This is the main position of the kangaroo mother care. Okay. Next, okay, these are the clothing of the baby. Okay, while giving the kangaroo mother care, we have to wear the cap, front open shirt, socks and nappy to the baby. In some case, we can also avoid, or we can. Okay, the next we will discuss the kangaroo position. Okay, so for the kangaroo position, we have to place the upright position. We have to keep the baby in upright position between mother breast, and baby's head should be turned one side. Okay, so we have to keep the baby in front, between the breast of the mother, and we have to turn the baby's head, that may be the left right turn, that may be the right turn, to provide or to prevent the apnea to the baby. Okay. Next, their baby's hip should be flexed and abduction in frog position, and the arm should be also flexed. Okay, so we have to keep the baby like a frog position between the two breasts of the baby. Okay. Next, the baby's abdomen should be at the level of the epigastrium. Okay, the baby's abdomen should be we have to keep the baby abdomen at the epigastric level of the mother, so that the baby, so that the mother can heart the heart rate of the heart of the baby. Okay. The next, simultaneously we have to give the breastfeeding to the mother, to the baby. The mother should explain how to breastfeed when the baby is in the kangaroo position. So okay. The next, monitoring. We have to monitor continuously and carefully kangaroo mother care, the procedure. While giving the procedure, we have to closely observe the mother and the baby. Okay, so is there any side effects of the kangaroo mother care? Is there any, we have to observe carefully physiological parameters of the baby. Okay. The next, it is the most important part, that is we have to provide the privacy to the mother and the baby while giving the kangaroo mother care. As you know, the mother is wearing the front opening gown. Okay, so while giving the kangaroo mother care, we have to give the privacy to the mother, and the hospital and the staff and family members should respect the mother sensitivities. Means we have to give the privacy to the mother while kangaroo mother care procedure. Okay, this is also we can this is one of the the equipment you can use while giving the kangaroo mother care. Okay, next, so it is one of the, we can summarize the, now we will summarize the kangaroo mother care. That is we have discussed the definition, kangaroo, the components, the benefits and the procedure of kangaroo mother care. Okay, so now we will conclude my topic. The topic conclude that KMC is very beneficial for both LBW babies and mother. And this is one of the assignment for you. Write down the benefits of kangaroo mother care. And this is on this test. That is the short answer question, that is describe components of KMC, and the long answer question, that is explain the procedure of KMC in detail. Okay, thank you.